Hello everyone and welcome to today's session on the management of asphyxia neonatorum. This is one of the most critical conditions we face in neonatal care. Every second counts and knowing exactly what to do can be the difference between life and death. Today we're going to dive deep into the essential steps, the equipment and the medications that are crucial for effective resuscitation. Asphyxia neonatorum is a medical emergency where a newborn is unable to breathe properly at birth. This can lead to severe oxygen deprivation affecting vital organs, especially the brain. Understanding the right steps and interventions during these first moments is essential for anyone involved in neonatal care. Our goal is to equip you with the knowledge and confidence to act swiftly and effectively. One of the first things to ensure in any neonatal resuscitation is that all equipment is readily available and functional. Think of it as a checklist. Suction machine with catheters to clear the airway, an ambu bag for manual ventilation, and various sized endotracheal tubes for intubation if needed. The room must be warm to avoid hypothermia, which can further complicate the baby's condition. Having everything set up and tested beforehand allows us to act without hesitation when every second matters. The primary aims of resuscitation are straightforward. We need to establish a clear airway, ensure the baby is breathing and circulating blood effectively, correct any acidosis that could damage the organs, and take steps to prevent infections. Additionally, preventing retrolental fibroplasia, which is an eye condition that can result from high oxygen levels, is also critical. Keeping these goals in mind helps guide our actions during those critical first minutes. Medications are a cornerstone of resuscitation, and knowing when and how to use them can save a life. For instance, if the mother has received narcotics during labor, naloxone can reverse respiratory depression in the baby. Sodium bicarbonate is administered to correct acidosis that can develop when a baby hasn't been breathing properly. Adrenaline comes into play if the heart rate is critically low, and dextrose helps in cases of hypoglycemia, which newborns are highly vulnerable to, especially during stressful conditions. Vitamin K is given to prevent any bleeding. Upon delivery, quick action is crucial. Start by gently wiping the baby's eyes, mouth, and nose to clear any secretions. Check for the umbilical cord around the neck. Sometimes this simple action can immediately improve the baby's condition. Place the baby on the mother's abdomen to provide warmth and comfort. Timing matters, so make sure you record the delivery time accurately. And once the cord is clamped and cut, wrap the baby to maintain warmth. After initial interventions, place the baby on a resuscitator, begin suctioning if needed, and provide oxygen. It's all about reassessment at every step, especially at the 5-minute mark to determine if further action is needed. At the 5-minute mark, we use the ABCS approach: airway, breathing, cardiac function, and shock. Check that the airway is clear. Sometimes, simply repositioning the baby's head can make a significant difference. Assess breathing. If the baby is still struggling, consider escalating to bag mask ventilation or intubation. Cardiac function is next. If the heart rate remains low, medications like adrenaline may be necessary. Lastly, monitor for signs of shock such as poor perfusion and address it promptly. If after initial stimulation the baby doesn't cry or breathe, don't panic but act methodically. Start by drying and stimulating the baby, which can often jumpstart breathing. If that doesn't work, sanction the mouth and nose to clear any obstructions. Bag mask ventilation should be initiated if spontaneous breathing isn't established. Aim for about 30 breaths per minute. If there is still no response, proceed with CPR using a 2 to 14 ratio of compressions to ventilations. Administer adrenaline to stimulate the heart, and if necessary, intubate to provide a direct airway. Sodium bicarbonate and dextrose are used to manage acidosis and hypoglycemia, respectively. If, despite all efforts, there is no improvement, the baby needs to be transferred to the ICU for further management. Once we've stabilized the baby, our work isn't done. Transfer the newborn to a special care unit where ongoing monitoring is critical. Maintaining a clear airway, continuously checking the vitals, and ensuring the baby's temperature and blood sugar levels remain stable are essential aspects of post-resuscitation care. Placing the baby in an incubator helps to maintain body temperature and allows for easier observation and monitoring. Infections can severely impact a newborn's recovery, so it's important to use sterile techniques during all interventions. The environment around the baby should be kept clean and dust-free, which reduces the risk of infections. Don't forget to involve the mother, educate her on the importance of hand hygiene and how to care for her newborn in a clean manner. Nutrition is a key part of recovery for the newborn. Feeding should be done every 3 hours with expressed breast milk. If the baby cannot feed orally, consider using a nasogastric tube to ensure they receive the necessary nutrients. It's also important to monitor the baby's fluid intake and output closely to avoid any imbalances. And remember, keeping the baby warm isn't just about comfort. It's critical for maintaining glucose levels and overall stability. Finally, never underestimate the power of involving the family, especially the mother, in the baby's care. Teaching her breastfeeding techniques, encouraging her to express milk, and letting her participate in simple care activities can be incredibly empowering. It not only helps the baby but also strengthens the bond between mother and child, supporting the emotional needs of both. Asphyxia neonatorum is a challenging condition, but with quick, well-coordinated actions, we can significantly improve outcomes. Remember, preparedness, continuous assessment, and involving the family are crucial in the management process. Thank you for joining this session. See you in the next session.